just want to send my wife away. She has been giving birth to girls. Is it from the man or the wife?
There are some males that naturally they are not producing sperm. In our environment, it is the male side that is always firing the woman.
It is women that are supposed to be angry that
leaving your house. No, seriously. The fact that people just got married and then in 1 year, 2 years, you have not seen them get pregnant, it doesn't mean that they actually have infertility. A girl that is 16 years and above that have never menstruated in life should be worried. If you give me Y, I give you boy. If you give me X, we have girls. We majorly look at the woman that she's the one having problem. But honestly, it can either be the woman or the man. And sometimes it can be two of them. My name is Kemi Oshundara. I'm a medical doctor. I'm specializing in women health generally, that we call obstetrics and gynecology. I love solving women's problems.
This program is sponsored by Exodus Holistic Clinic. Welcome, man.
Thank you very much.
I love the fact that you said you love solving women's problems.
Yeah, because I'm a woman.
So even me, I love solving men problems.
It's okay.
Why is it so important for women to start worried about their period, and how is period so important to women?
Menstruation is actually very important. It's one of the things that defines you as a woman. If you have secondary sexual characteristics like you have grown breasts, you have pubic hair, you have axillary hair, and then you have not started menstruating, there's nobody that will not be worried. Menstruation assures you that you have a womb, because of course the blood that we see that we call menstruation comes from inside the womb, from the shedding of the lining of the womb. And at what age should a woman be worried? When they have not started menstruating. A girl that is 16 years and above that have never menstruated in life should be worried. Not just the girl, even the parents or the guardian should be worried. Normally, a girl can start menstruating anytime from age 9 to 15. But if a girl clocks 16 and has never menstruated, it's something that the girl should see a gynecologist, because there may be so many things that can cause that. It doesn't mean that the girl does not have womb.
Can you just give us one thing?
There are people that have a congenital anomaly in which they are normal females but they don't have a womb. It's possible. There are people that have womb and then there's a blockage on the way, maybe in the cervix, in the vagina, where she's actually menstruating but it's not coming out.
Oh, inside.
Those ones will have a cyclical abdominal pain. They may be having this abdominal pain every month. There may be swelling of the abdomen. That means most likely the girl is menstruating inside, but there is no way for the blood to flow out. Surgery can cause that. Some people have done surgery where the womb have to be removed. It's one of those things that can actually cause a woman not to menstruate. And some other drugs like chemotherapy. There are some people that have cancers that they are on chemotherapy. Menstruation is shedding of the inner lining of the womb, and when the inner lining is healed together, there's nothing to shed, and then the person will not menstruate. There are a lot of things that can actually cause that.
That means something is wrong somewhere.
Yes, definitely. So a child that is 60-year-old and have never menstruated should see a gynecologist.
People that are not pregnant, they are not breastfeeding, but they are lactating. What can you say about that?
Medically, we call it hyperprolactinemia. It can happen. Nobody just know what causes it. A girl or a woman that is not breastfeeding, is not pregnant, will just start seeing milk coming out from their breasts. This actually may cause an imbalance in the hormone of the woman that is having that problem, and the woman may be finding it difficult to get pregnant with that. It has treatment, of course. Hormonal imbalance can be a cause, and also there are some tumors or a mass maybe in the brain that is producing prolactin hormone, and when that happens, it makes the milk to be secreting, and this needs to be taken care of, especially to help a woman that actually is concerned about her fertility. Yes.
Nowadays we have a lot of infertility cases, and it's getting out of hands because couples now, the major goal for them is how to have their own children. Especially in Africa, they gave birth to me, I want to give birth to my own. My grandma is turning to great grandmas and there is nothing to show up. What are the major causes of infertility?
Okay, thank you very much.
Yes,
the causes of infertility can actually be divided into two: the woman's problem and the man's problem. Definitely, it's takes two to tango. That's a general talk. And then for a woman to give birth, of course, it involves the husband and the wife. We majorly look at the woman, that she's the one having problem, but honestly it can either be the woman or the man, and sometimes it can be two of them. In women, there are a lot of things that can actually cause that. Like we have discussed, we talked about hyperprolactinemia. Generally, hormonal imbalance can actually cause infertility in women. There are some women that are not ovulating because of the hormonal imbalance, and then if you are not ovulating, that means you are not releasing egg that will be fertilized by the husband's sperm to become a baby. So that may be a major problem on the side of the woman. At times there are some women that they don't have enough eggs in their ovary. It's not their fault, it's not anybody's fault. There is no how they want to release egg. You need to release egg every month. It depends on the ovary. Do you really have eggs that can grow and be released every month? So some people may not have enough eggs in their ovary. I'm just saying,
lifestyle changes,
lots of things can happen. Some people on medications, exposure to radiation, chemicals and so on can actually cause that. As important as the ovaries, that's the bags of egg, another thing that is very important is the tube, the fallopian tube of the womb. The female reproductive organ, from the vagina to the cervix, which is the entrance of the womb, and then to inside of the womb, we call it endometrium, and then from there the sperm moves to the tubes, and then the egg must have been in the tube too. So they meet in the tube for fertilization. But there are some women that their tubes are actually blocked. So many things can block the tube: infections, pelvic inflammatory disease. Some people have had surgery that has affected their tube. Some people just naturally, some tubes may not just be open. There's a rope and then it does not have hole inside. It's not their fault actually. So those are the things that can actually affect the tube. In males, there are things that can actually cause infertility too. There are some males that naturally they are not producing sperm. Even if they have ejaculation, you will see liquid, but by the time they are checked under microscope, there is nothing inside the semen. Some, they are not producing sperm at all, while some, they produce sperm, but maybe the tube where the sperm will pass through to come out is blocked. The woman has her own tube blocked, man can also have their own tube blocked, and then sperm is not coming out, it's just the liquid that is coming out. You know mumps disease in children, that the cheeks will be swollen. Sometimes it may affect the testes, and then the man may not produce sperm. It's a viral infection that can actually affect the testes. So that's why care from childhood is very important. Not just when I'm grown up, okay, I'm married now, I'm not getting pregnant, then I want to go and do tests. No, you should take care of your children. If you see anything that is strange, quickly seek help so that it will not affect the future of that child. Yes.
Thank you very much.
Yes, thank you.
Another thing that is causing problem in homes these days is, I want to send my wife away. She has been giving birth to girls. I don't know why this thing is. Better carry all these your girls away. The giving birth of girls, is it from the man or the wife?
On a lighter mode, it's girls that take care of parents. To be sincere, how many men have you seen these days? They are always thinking about their nuclear family. My wife, my children must eat. But if you see girls, they are thinking about their parents. I hope my mom has eaten. I hope my dad is fine. So that's just on the lighter mood. Now back to our question, that is it the fault of the woman when they are giving birth to girls alone? No, it's not fault of the woman. It is what the man gives the woman that she brings out. Medically, a woman's egg will always produce a X. I don't know how to explain this one in a layman language, but a woman's egg will always carry X, and the man's sperm carries X and Y. It now depends on which sperm fertilizes the egg. The X is there already. That's natural. That's how God has made all women. All our eggs are X. But the man's sperm, now, is it the Y that fertilizes the eggs? If the Y sperm fertilizes the egg that is X already, you have XY, then that's a boy. But when a X sperm from the man fertilizes the X already there, that's XX, it produces a female. So it's not woman's fault. So it is what you give me that I'm giving out to you.
So it is women that are supposed to be angry that I'm giving you
house, seriously, because we have X. All women, but no woman have Y. All women have X naturally. If you give me Y, I give you boy. If you give me X, we have girls. And honestly, there is none that is not a child. It's just our mentality in this environment that is making us to think girls, you see girls that are making it in life. Most males, at times, you see some are misbehaving somewhere. I've seen a lot of women online, even in our own country. There are big people that are really helping in the movement of our country. This is our mentality of, if I don't have a male who will continue to bear my name, it's really a big problem. And there are women these days that get married and then they compound their father's name with their husband's name. If you want somebody to be bearing your name, so forget about the name. It's the success of the child that matters most.
I want you to help me in talking to people like the husband, how they can support their wives, and wives, how can you support your husband too? Now, in infertility case, if you notice that it is your wife that is having difficulty, how can you support? If you notice it's your husband too, so help us to give people advice.
Whatever you do in life, if you have support, there is no how you will not be successful. But a woman that is having issues with infertility, by the time we have checked, it's a woman that has problem. If the woman is well supported, the woman can be taken care of and will get pregnant by whatever means. Even if it's an assisted reproduction, definitely that can happen. But if she's not supported, it's time to go for the clinic, or be for a follow-up in the clinic, and then the husband is not interested, is being challenged, is not being consoling the woman, not supportive, the woman need money to do one or two things concerning the infertility, the husband is not in support. There is no how the woman herself will be encouraged to seek help. And if the woman gets pregnant or have children, it's not only the woman's child, it's for the two of them. And not just on the woman's side, so even on the male part, there are some males that they are the problem, they have issues with their fertility. The woman should be supportive, because even if you're on treatment, you have people around that are supporting you, they are encouraging you. There is no how, even if the medication or the treatment does not want to work, it will definitely work. We have checked in the hospital and they told me I'm the one, my tube is blocked or something, and then the husband should now abandon the wife, or be any little thing. That's why you are not able to give birth. That's why your womb has done this, has done that. It's really bad doing that. And the emotional support most of the time helps. Some people, they will be on treatment for infertility. Just surprisingly, the woman just gets pregnant. If you are happy, if you are well taken care of, you have support that you need, somehow it helps. But you see people, they are on treatment is not working. Go and check psychologically, the person may not be stable. It's very important to be supportive to your partner, whether it's male or female. And in our environment, it is the male side that is always firing the woman. Then this issue of the husband's family having issue with the woman that is not pregnant, it's really rampant in this environment. At times, the husband family may not know it's the husband that have problem. Within 3 months, they have not seen your tummy coming out. Everybody is looking at you. Somebody is somewhere asking how far, what is going on. It's really not necessary. The joy of the couple is the main goal. And then even if they are not achieving pregnancy as at when they should, they need more of support and encouragement than now condemning the woman. Another thing is, if there is a problem, you may not need to tell people, it's my husband that have problem, it's my wife that, we have checked, they said that she does not have womb, they have checked, they said that tube are blocked. It's not necessary, really. It should be between husband and wife. And then you will see some couples, they have decided that, after marriage, they don't want to get pregnant for like another 1 or 2, 3 years.
So they can enjoy themselves.
Yes, enjoy friendship before babies will start coming in and joining them. So the fact that people just got married and then in 1 year, 2 years, you have not seen them get pregnant, it doesn't mean that they actually have infertility. It might be their decision to hold on.
Do you know there are some people that they will have maybe a boy and they decide to just relax more, maybe because of the economy or anything, for another pregnancy? So after like 2 years, 3 years, they decide to, babe, let's do this thing. They've been trying and it's not coming up. What do you think can be the cause of this?
That is what we call secondary infertility. A woman might have been pregnant before and then finding it difficult to achieve pregnancy again. It happens. The fact that somebody was fertile, was was able to get pregnant before, not just the woman, even the man. The fact that a man was able to impregnate someone before does not mean he cannot have problem that will not be able to impregnate a woman again. So those kind of things, they are generally like all those things that we have talked about. The tube can get blocked after the first pregnancy. Infections, what happens around the previous deliveries, the age of the woman, the present hormonal state of the woman can actually affect that. And even the man, the fact that he was producing sperm before does not mean he's still producing sperm now. So those people should actually seek help. They should go for investigations, see doctors, and then whatever problem is identified can actually be sorted. Not just people that have given birth. Even if somebody was pregnant, she had miscarriage, and then it was difficult getting pregnant again. It happens. It's things that we see day in, day out. So all they just need to do is see a qualified medical personnel that can actually do investigations of what could be causing that, and once that is identified, it can be treated.
Thank you very much, man.
Yes, sir.
I really appreciate your time. And we hope if we call you another time, you will show face.
Definitely. So far is about woman. Yeah, we definitely.
Thank you very much.
Yes.
We really appreciate you for watching this video to this stage. Always remember that you need to follow, like, and subscribe. Follow us on all social media, Facebook, Instagram, and TikTok. Thank you very much. See you again.